We will now start our second to the last meeting for the subject pediatrics, concepts in pediatrics. So as you know by now, we are already done with some of the systems when it comes to review of the newborn. So right now, we will be discussing about the neuromuscular system. So when we say neuromuscular system, these pertain to your muscles. You also have your brain along with the spinal cord. So basically, ito yung mga movements ng katawan natin when we talk about neuromuscular system. Okay? The connection between your muscles in the body and the brain. Kaya siya tinawag na neuromuscular system. Now, when we look at the neuromuscular system of the neonate, it is manifested by the control of the body parts. So ibig sabihin po, pag maganda yung movement ng katawan ng neonate or ng newborn, that goes to show that the neuromuscular system of the neonate is intact. Okay? So the absence of a movement, kunwari meron siyang isang body part na hindi maigalaw, an absence of a movement is never a normal finding during the neonatal period. Kasi pag hindi niya nagagalaw yung isang parte ng katawan niya, that goes to show that there is a problem in the neuromuscular system. Baka merong problema sa nerve, may problema sa muscle, may problema sa mismong bones. Okay, so dun natin makikita using the assessment that we have in the neuromuscular system. Now, when we talk about twitching or flailing movement, ito yung parang agkasjay, DJ, parang how do you say that? Ag-jitter ko masuna. Or bigla nga agkasjay. Kasi makita yung dagay ubing met nga, bigla-bigla nga aggaraw-garaw da nga lalo na makigtot da. That's what we call twitching or flailing, yung uncontrollable movements of the extremities. Di ba? Nagpalakpak ako mga sisasango di ubing agkasjay suna. Okay, that's what we call twitching and flailing. Now, nakikita natin ito in the neonates, even without any stimulus. Bigla-bigla nga kikigto da di ubing, that's normal. Why? Because it is due to the immaturity of the nervous system. Okay? So normal finding lamang po yung twitching or flailing even without stimulus because there is the immaturity of the nervous system which makes these newborns act or move like that. Ngayam nag-twitch ka or nag-flail ka, kasdi ka, nga hang kami nga newbornen. Okay? Kunwari, kanyayo ko more than 15, 16 years old kayo, nag-twitch kayo pailaing, that is not anymore a normal finding. Okay? Nakikita lang natin ito to be normal if it is in the neonate. Kasi nga immature pa lang yung nervous system nila. Now, we also have the term reflexes when we talk about the neuromuscular system. Pag sinabi nating reflexes, these are movements of the body which are uncontrollable. Ibig sabihin, ginagawa lang ito ng katawan even if hindi kontrolado na ng utak. A good example of this is your blinking. Pag kayo pag kunwari, ikasjida deta rupayo, okay? You automatically blink your eyes. Bakit kaya? Even without thinking of blinking your eyes, agblink kalatan. That is what we call reflexes. These are actions that are automatically done by the body and they are assessed to determine abnormalities in the neuromuscular functioning of a newborn. Anong ibig sabihin nito? Ginagamit natin ang mga reflexes to assess how well the neuromuscular system is in the neonate. Tinitignan natin yung mga different movements or reflexes ng bata so that we can determine kung normal ba yung neuromuscular system nila. So, again, it's very important that you know the different reflexes in the newborn. Okay? Para malaman ninyo kung normal ba yung neuromuscular system nila. Now, the first reflex, like I said a while ago, is the blinking reflex. Yung blinking reflex, it is a reflex to protect the eye from any object coming near it by rapid eye closure. So, makita mga napig sa tiangin, agkidem ka bigla. Okay? So, nagra-rapid eye closure ka because your body is telling you to protect your eye. So, kahit hindi mo siya iniisip, automatically ginagawa na yan ng katawan mo. So, that is a reflex, di po ba? automatic na ginagawa ng katawan. Okay, so that's number 1, blinking reflex. Next, we also have what we call the rooting reflex. Pag sinabi po nating rooting reflex, if the cheek is brushed, dito po, dito yan tiping-ping na, if the cheek is brushed or stroked near the corner of the mouth, a newborn will turn the head in that direction. Nyati kaya na sa amin, Dejay, pag yung bata daw, tinatouch natin yung side of the mouth either dito or dito, okay, the newborn will turn to that direction. So ano, isagid-sagid yun yung nipple ditoy, okay, sagid-sagid yun ditoy na, the newborn will turn to that direction. Always remember that the rooting reflex is a feeding reflex. Tumutulong po siya na initiate yung breastfeeding sa newborn. Always remember that the eyes of the newborn are not yet functioning well. At kahit pa nakikita niya yung nipples, hindi niya alam kung anong silbi nun. Okay? So we use the rooting reflex to help the newborn find food. So paano po natin ginagawa? We instruct the mother to rub or stroke the cheeks, okay, using the nipples. Taano na isagid-sagid mo ditoy, because of the rooting reflex, sumango di ubing kanya na agammal to dejayan. Okay? So rooting reflex, it is a feeding reflex that helps the newborn find food. And remember that it disappears at the 6th week of life when the baby's eyes already start to focus. So nawawala po yung rooting reflex. Okay? Nawawala siya sa 6th week of life kasi kailangan niyang mawala kasi na yung eyes ni baby is nade-develop na. So he can already see where the nipple is. Amuran tununod tati amalan na. Kasi nakakakita na siya. But during the first few weeks of life, pwede natin gamitin ang rooting reflex to establish feeding. Next, you also have what we call the sucking reflex. Now, paano natin ginagawa ito? When the baby's lips are touched, especially dito po sa lower lip, okay, dito po sa baba, okay? When the baby's lips are touched, the baby makes a sucking motion. So, paano natin gagawin ito? This is also a feeding reflex. So, no inkas J tayo, nag-rooting reflex isunat, sinango na dyan nipple. And the next thing that we are going to do is we tell the mother to rub the nipple on the lower lip of the newborn. Okay? So, when the newborn's lower lip is touched, he will start to suck. Okay? Ma-elicit natin yung sucking reflex and the baby will make a sucking motion. So, again, this reflex helps in both breastfeeding and bottle feeding. So those are the 3 reflexes. Ano pa po? We also have what we call the swallowing reflex. Okay? The swallowing in the swallowing reflex, the food that reaches the posterior portion of the tongue is automatically swallowed. Pag sinabi po nating posterior portion, ito po yung likod ng dila. Okay po ba? Now, sabi dito, lahat-lahat daw po ng pagkain that reaches the posterior portion of the tongue. Dito kung matidila niya. Silikod na. First half, second half. Okay? Amin nga makan, all food that reaches the posterior portion of the tongue is automatically swallowed. Tilmunin to insigida ni newborn dyan. That's what we call the swallowing reflex. Okay? Now, we also have other reflexes na pwedeng maka-interfere sa swallowing reflex. And we call this the gag reflex. Dulok ka. Or parang you get nauseous. Gag. Okay? Coughing reflex and sneezing reflex. All of these reflexes work to clear the airway. Example, naka-tilmonis DJ ubing ti, impan na DJ ngiwa na, in-swallow DJ ubing, and then there is a blockage on the airway. What will happen? Yung gagging and coughing and sneezing reflex will kick in. Okay? Bakit? Kasi alam ng katawan merong blockage dito sa airway. So what will the body do? Either magagag yan, okay, to push out the blockage, either magka-cough yan or mag-sneeze to clear the airway. Okay, so those reflexes help clear the airway, okay, in case that the newborn swallows inedible substances. Okay, we also have the extrusion reflex. Sabi dito po sa extrusion reflex, a newborn extrudes any substance that is placed on the anterior portion of the tongue. Kanina po sa swallowing reflex, all food that reaches the posterior portion, jilikod ti dila, tilmunen. Dito naman po sa extrusion reflex, newborns extrude any substance that is placed on the anterior portion of the tongue. Kaya nasa amin dito, amin nga makan that only reaches on the lower part of the tongue, dito nga parte. Okay? It will be extruded by the newborn. When you say extruded, itupra na. Idurun-durun na using the tongue. Okay? That's what we call extrusion reflex. So, nung makakita kay ti newborns nga, ay ayamin na DJ gatas na ni kunana DJ paglabulabutaben na DJ yan ti ngiwa na kunana. That goes to show that there is the extrusion reflex. Okay? Hindi niya pinaglalaroan yung gatas niya, kundi yung mga substances na yon, they did not reach the posterior portion, kaya sila hindi na swallow. Saan lang sila? Nandun lang sila sa anterior portion, kaya it is being extruded by the neonate. Okay po ba? Next. Extrusion reflex, along with the cough, the gagging, and the sneezing reflex, they are also, the extrusion reflex is also a protective reflex for swallowing inedible substances. So, ibig sabihin, the extrusion reflex helps protect the newborn so that the newborn will not swallow inedible substances. So, no ipan na ko madayjay newborn, dayjay mesa nga banag, dayjay yanti kunwari, butones ko maor ko, ipan na iwa na. Hamay nga nakadanon di posterior portion, no di kaya anterior portion ng what will the body do? The body will automatically extrude anything that is placed on the anterior portion of the tongue. Okay? So, sir, nawawala ba ang extrusion reflex? Yes. The extrusion reflex disappears at 4 months of life. So, nawawala yan pag 4 months na si baby. When the baby already starts to spit up or refuse solid foods that are placed on the mouth. Okay? So, nga no 4 months na ubingin, nawawala po yung extrusion reflex. Bakit? Kasi kaya na niya using his own brain. Kaya na niyang spit up or mag-refuse ng solid foods kung ayaw niyang kainin. But if the newborn is still younger than 4 months, i-extrude niya anything that is placed on the anterior portion of the tongue. Okay. Sir, lumalabas ba po ito sa mga board exams? Yes. All of these come out in the board exams, so you should review them. Okay? We also have the term palmar grasp reflex. When we say palm, ito po yun. Okay? The palm of your hands. In the palmar grasp reflex, the newborns grasp any object placed on their palm by closing their fingers on it. So siguro nakakita kay metten, the gidjay newborns that enjoy grasping your hands. Diba? No, iigam yo kumadijirama yo, baby, kunam kuma, pet-petan na dejay. Okay? Hindi po dahil sa gusto kayo ng bata, kundi reflex lamang po yun. Sabi dito sa palmar grasp reflex, anything that is placed on the palm of the newborn's hands will be grasped. Okay? Ganun po ang palmar grasp reflex. Now, we also have the term step in or walk in reflex. Okay? Dito naman po, the newborn who is held in a vertical position, okay, patader kuma, with their feet touching a hard surface will take a few alternating quick steps. Nakakita kiti ubingin nga pagpanpanchuken nyo kuma. For example, the newborn is still 3 to 4 months old. Pagpampanchuken nyo, padasan nyo nga ita der isuna di jayan tila misaan, and then the sole of the foot, di mukod tisaka na, matouch na di jila misaan. What will the newborn do? The newborn will take a few alternating quick steps kas lagmarcha di ubing kung kunayo ke di. That's what we call the step-in reflex. Ibig sabihin nun, hindi pa ready na tumayo sa kanyang sariling paa si newborn when that is still present. Okay po ba? So that's what we call the step-in or the walk-in reflex. If the newborn is held in a vertical position and then their feet touches a hard surface, mari na na dejayanti mukod na dejayanti lamisaan kuma or jiswelo, and then agmarcha-marcha, walk-in or step-in reflex lang ang tawag doon, and that means that the newborn is not yet ready to stand on his own 2 feet. Okay, let's take a closer look at how these reflexes look like. So that's the swallowing, that's the extrusion reflex, I should say. So makita yo, the newborn is extruding the food that is placed on the anterior portion of the tongue. The other picture is what we call the extrusion reflex. The newborn grasps any object that is placed on the palm of their hands. Dito naman po yung tinatawag natin na step or walk-in reflex. So makita yun niya, the newborn, impadas na nga in pinata derngem, ag take met few alternating quick steps. Now, we also have what we call the placing reflex. When the baby's anterior surface of his legs, okay, dito kumasaka na niya, dito digisaka na, dito yan ti shin area nga kunatayo. When we say shin area, dito yan ti, amoy dito yan ti tumingyo, dito baba na. Okay, dito ti shin nga kunatayo, S-H-E-E-N. When the baby's anterior surface of his legs touches a hard surface, the newborn takes a few quick lifting motion as if to step on a table. No, dito ko man di ubing niya, dito gisaka na kuma. And then, may sagid yu diyan tilamisaan, ingato na gisaka na, as if to step on the table. You will see a picture later on so that you will better understand how the placing reflex looks like. Okay, so basically yun. No masagid de diyan ti anterior surface or sango nga parte ti legs na, the newborn will lift his legs as if to step on the table. Okay? We also have the plantar grasp reflex. Katulad din ito ng palmar grasp reflex, wherein anything that is placed on the sole of the foot of the newborn, kung anything na nilagay natin sa mukod na, dapan ko na kuma. Anything that we place on the dapan or the sole of the newborn's foot, the toes grasp in the same manner as the fingers do. So, kasjimit laeng de jayanti, saka na. Kaya siya tinawag na plantar grasp reflex. Okay? We also have what we call the tonic neck reflex. When a newborn lies in their backs, no nakaida ko madedyo ubing niya. Okay? And when we turn the head to one side, okay, ipasikig tayo, di ulo na either left or right, their arms and legs are extended. So agdiretso kano de saka ken imana on the side where the newborn is facing. While the opposite arms and legs will either contract or fold. So detoy ag-contract detoy yanti mesa nga saha na ken ima na, okay? Diji sangsangwen na nga parte, diji saka ken ima na agdiretso nga kasjay. Okay? I will show you a picture later on. Kaya siya tinawag po na tonic neck or boxer reflex or fencing reflex. Paki-change po yung nasa handouts nyo, baka tonic neck pareho. Kaya siya tinawag na tonic neck, boxer reflex, or fencing reflex. Amo yung fencing ko ma, dito dati espada na, nga eskrima. Okay? Yan po yung itsura ng bata. Okay, so let's look at it. This is the placing reflex. So makita nyo, the newborn is held in the vertical position. The feet, anterior portion of the legs, touches a hard surface. And then the newborn lifts the leg as if to step on the table. That's what we call the placing reflex. We also have the plantar grasp reflex. Anything that is placed on the sole of the newborn's foot, the toes will grasp in the same manner as the fingers do. And then kasadi bagbaga tatay nga boxing reflex, kita nyo jubing kay kasla makibugsing. The newborn is facing the right. So makita yo kung saan siya naka-face, doon natin makikita na nag-extend yung both arm and leg niya sa right side din. And then on the opposite side, yung hand niya and foot are also contracted. Kaya siya naka-boxing, kasan makibugsing picture na, kaya siya tinatawag na boxing reflex and then fencing reflex. Okay? So this is what we call the tonic neck reflex. So clear naman so far. Okay. Next. We also have the moro reflex. Ito yung pinakamadalas na nakikita natin sa mga bata, okay, sa mga newborns. Dito ko na doon, nagpigsa kami pinangirikep mo dito arawangan, so nga agkigkigtut pwede dyo ubingin. That's what we call moro reflex. We startle the newborn. Pag sinabi nating startle, gulatin natin sila by making a loud noise or by jarring the bassinet. No masagid yung kumadedya pagididaan ng bassinet or DJ kumakrib. And then the newborn abducts their head, agkasjay ni agbigbig lang agkas na agkukot. Okay? The newborn abducts their head, arms, and legs. Ang tawag natin doon is moro reflex. Okay? Ang other term po ng moro reflex is the startling reflex. So, kaya po siya merong ganito dito. Startling ko na nangamin dito ini. Di ka di? Okay. Next, we also have the Babinski reflex. Okay, ito yung favorite nila sa board exam, so please underline the term kasi ito po yung every year lumalabas. Okay. The Babinski reflex is done by writing or, sorry, not writing, actually drawing an inverted letter J on the sole of the foot of the neonate. Okay? And then the neonate will fan their toes. Kunwari, dati kung majidapan na di ubing niya. Okay? Ag-drawing tayo ti letter J nga pabaliktad. And then, the newborn will fan their toes. Agkasjay. Yan po yung tinatawag natin na Babinski reflex. So, nawawala po ang Babinski reflex at 12 months of life. Normal lang po na nakikita natin ang Babinski reflex for both infants and newborns. Kasi nga, nawawala lang po siya pag 12 months na yung bata. Pero, pag ginawa mo ang Babinski reflex sa isang adult, that is already considered abnormal. Okay? So, lagi pong tataandaan, we draw an inverted letter J, the newborn's toes will fan out. Okay, Babinski reflex ang tawag doon. Pinaka-importanting tatandaan is it disappears at 12 months and it is also abnormal in adults. We also have the term magnet reflex. Dito po sa magnet reflex, haan nga DJ, ti panunutan yung magnet, kaya haan nga DJ magnet nga agdikit da, nga north and south pole, kaya they attract each other. Now think of the repelling side of the magnet. DJ magnet nga duwa nga north and north, ano, south and south, anong mangyayari, di ba, agdinurunda. Okay? That is the magnet, that's the reason why it is called the magnet reflex. Sabi dito, if pressure is applied to the sole of the foot of the newborn, lying in supine position, he or she pushes back against the pressure. So, kunwari yung newborn nakaidda. No, nakaidda di newborn, and then idurun yu di yan dapan tisaka na, you apply pressure, okay, idurun na met or kasla makikinugtar ni newborn. So, that's what we call the magnet reflex. I will show you a picture later on. So, let's look at the pictures. Pag meron pong magnet reflex yung isang newborn, it indicates the integrity of the spinal cord. So, ibig sabihin po, maganda yung communication between the brain and then the spinal cord mo. Kasi nakokontrol ng bata yung kanyang lower extremities. Okay? So, makita mga nga paralyzed di newborn, no, at dati magnet reflex na. Okay? So, that's what we call the moro reflex. So, makita yo, agtigtot di ubing. The newborn is abducting both hands and feet along with the head. We also have the plantar grasp reflex. At the plantar grasp reflex, anything that we place on the sole of the foot, ag kasjay dejay, ag grasp met dejay and toes na. This is what we call the Babinski reflex. So we draw an inverted letter J, ag start tayo dyan timukod, mapan dejay babati, fingers, the toes, sorry. And then we draw an inverted letter J, nyati mapasamak, ag fan out dejay toes. Okay, Babinski reflex. And then this is what we call the magnet reflex. So makita yo idurduron dejay caregiver or the midwife, the saka the newborn, di baba. What will the newborn do? Ikugtar na nga agpangat, ikugtar na against the pressure. If you apply a pressure on the sole of the foot. So makita yo deta na dejay yan timukod na kay ibalbaliktad na, okay, idurdurun na. What will the newborn do? It's pushing against the pressure. So that's what we call the magnet reflex. Okay naman po ba? Naiintindihan naman na ngayon. I know for a fact na medyo siguro narigatan kayo nga ng awat kadeta nga lecture you kasi you cannot imagine it. But now that you are guided accordingly, at least ma-imagine yon how we elicit these kinds of reflexes in the newborn. Okay. We also have what we call the cross extension reflex. Pag sinabi po natin cross-extension reflex, if one leg of a newborn who is lying in a supine position, okay, the newborn kaya nakaidda, okay, is extended and the sole of that foot is irritated with a sharp object, the newborn raises the other leg as if trying to push away the hand irritating the other leg. Imagine nyo kung manya the newborn, dati tisaka na, nakaidda suna, and then you got one foot, di mesa nga saka na inalayo, and then di yan timukod ti sa ka na, you irritated it with a sharp object. So kunwari kinilikiliyo. Kiniliti-kilitiyo, di yan timukod ti sa ka na. Okay? What will the newborn do? The newborn will use the other foot to kick or push away the hand, irritating the leg. Magets po ba? Kaya siya tinawag na crossed extension reflex. Okay, apaya, di mesa nga sa kati iritaem, but the other one is reacting. Kaya siya tinawag na crossed extension. So again, the newborn should be in supine position. So nakaida, you get, okay, you get the one foot, and then you irritate that sole of that foot using a sharp object, and then the newborn will raise the other foot and then kick or push away the hand, irritating the leg. Okay? So that's what we call the crossed extension reflex. We also have the trunk incurvating reflex. Pag sinabi po nating trunk incurvating, the newborn should be in the prone position, nakapaaleb. Okay? Paano makita tayo dito trunk incurvating reflex? The newborn should be in a prone position, and then the newborn's back is touched along the paravertebral area by a probing finger. Pag sinabi po natin paravertebral area, dito ko medyo vertebrae niya or the spinal column yo, di kadi. At datilasag na DJ left and right. Okay po ba? So di yan ti paravertebral area, di yan ti vertebrae or spinal column, at datilasag na in left or right. Tatanta, no makita tayo dito trunk incurvating reflex, what we do is, sagiden tayo, DJ yan ti side of the paravertebral area. Either the left or right. Makamukha yun niya ti kaya yung i-touch. Okay? And then, isagid yun DJ from up to down or down to up. What will happen? They will flex their trunk and swing their pelvis towards that direction. Kasla ko mami lang nagdidad do mga tatao nga nasagidem ti sibet da, ikas jida. Okay? Sagidem di yan ti bangit, ikas jida. Kasla ko mga arieken tayo di likod di newborn. No agreakso na, di yan ti likod na, then there is spinal cord integrity. Again, in the trunk incurvating trunk incurvating reflex, we touch the paravertebral area. Okay, either left or right, and then no sinagid tayo they will flex their trunk towards the touch. Okay, so trunk incurvating reflex. In no tanong ng tartaras yung ma-imagine, kilya-kilyan yung jilikod na. Okay, kanana ni Jai. Okay. So next, we also have the Landau reflex. Sabi po sa Landau reflex, a newborn who is held in a prone position with a hand underneath. So dapat medyo ubing nakapaalib manen. With a hand underneath supporting the trunk, they should demonstrate some muscle tonicity. Ito yung nakikita nating reflex pag pinaglalaroan nyo yung newborns ng Superman. Nay, Superman! Kung na yung magkapagkatenso na nga ipagpaaleben. Di yan ti imayo. Kasi yung kumanya, pagpaaleben nyo makita yung agpasiktil may gisaka kan ima na. Ang tawag po natin doon is Landau reflex. Okay? So para hindi na po tayo mag-imagine, ito po yung mga picture. So you get one foot of the newborn and then irritate it with the sharp object. What will the newborn do? The other foot will push or kick the hand, irritating the sole of the foot. So yan po yung crossed extension reflex. Makita yo? Itajim mo na? Okay? Ari-ari ganda. And then ikugtar deja ubing dejay irritating hand. Okay? The hand irritating the sole of the foot. Ito naman po yung tinatawag natin na trunk incurvating reflex. We touch the paravertebral axis or area of the newborn who is in prone position, and then yung tibrain na ag-curve suna, mariek. Okay? That's what we call the trunk incurvating reflex. And then this is what we call the Landau reflex. A newborn who is held in the prone position with the hand underneath supporting the newborn will demonstrate muscle tonicity in both upper and lower extremities. So makita yung nakapasikil at jubing Superman kung kunayo Landau reflex po ang tawag natin dyan. Okay? Sorry po. This is what we call the, sorry lang, I'll just edit the slides for a while because I think there has been a problem when with the animation. So far, naiintindihan naman po ba yung ating lesson? Okay? Pa-raise ng hand po kung nakaka-follow at na-appreciate nyo na ngayon yung ating lesson using the, because of the PowerPoint. Ayan, thank you Miss Padernal. Sino pa ay tinaka-appreciate? Miss Kampong and Jed Rose, thank you so much. Mawawatan yung medline along with Miss Tabor. Okay, how about the others? Sana naintindihan nyo po yung ating lesson. Okay, I think we're ready. Okay. So, meron din po tayong tinatawag na deep tendon reflex. Yung deep tendon reflex po natin, makikita yung dito nga kanayon, dijay, yan ti, pelikula, no, dati mapanti doktor ko ma, di bautan da di yan ti sa na, and then nagkugtar suda di ubing, or any patient, okay? When you tap the patella, when you say patella, it is the kneecap, di yan ti tuming you. When you tap the patella with a fingertip, the newborn kicks or jerks his foot. Dapat di mga agusar dati reflex hammer, di kasla dati goma na nga sinan triangle. That's what we call the reflex hammer. We can also use that pag adults na yung patients natin. But if we only have newborns as patients and we want to look at the deep tendon reflex, we want to elicit it, itap tayo laeng di yan ti patella na or yan ti tuming na using the finger. And then the newborn either kicks or jerks his foot. So tinatawag po natin yan na deep tendon reflex. Meron din po tayong tinatawag na parachute reflex. Okay? Before I discuss what parachute reflex is, can you use parachute in a sentence, Mr. Adame? Okay, use it. Kuna mo na. Okay. Honey, buksan mo yung ilaw. Bakit naman? Buksan mo yung ilaw. Parachute. Charing. Okay. Parachute. Sorry. Parachute reflex. A newborn who is held in a prone position with so detoy. A newborn who is held in a prone position with hand underneath supporting the trunk will spread his extremities when suddenly lowered. So ti pamayan tayo detoy is we are holding the newborn in a prone position. So nakapaalebso nang igiggaman tayo. And then we immediately lower it. Ipababa tayo kasla ko madigig Ferris wheel. Okay, ipababa tayo nga bigla. Ito braen na i-extend na both arms and feet ng kasla garamid ti parachute. Okay, tawag natin po diyan ay parachute reflex. We call that the parachute reflex. Actually, marami tayong mga different types of parachute reflex. Dapat yung parachute reflex nga no nakatagaw ko may newborn kay iduron mo suna nga pasango no agtumba, what will the newborn do? The newborn will cushion his fall. Medyo yan tipan nakadugmam na, isarapan na di sakaken, ima na. Okay, ima na. Dapat yung side parachute, back parachute, you will see them later on. Okay. So dito yung bagbagatay tatay nga deep tendon reflex. Okay? So we tap the patella using either reflex hammer or the probing finger, and then the newborn will kick or jerk his foot. Okay? Ito naman po yung tinatawag natin na forward parachute reflex. So no nakaigem tayo kada ubing, bigla tayong ipababa. Okay? The newborn will extend both hands and feet nga kaslagaramid ti parachute. Meron din tayong tinatawag na backward parachute reflex. Pag yung newborn tutumba, palikod, the newborn will protect and cushion the fall using the backward parachute reflex. Isarapan na gisaka na. Ay, ima na, sorry. And then the dapat side, but I did not include it anymore. Next, we also talk about the appearance of the newborn. Sa appearance po of the newborn, most of the newborns have ruddy complexion. Amin nga mayanak na newborns, normally, they have medyo color red in appearance due to the increase in the concentration of RBC, or what we call the hematocrit. Nangato gamin ti levels of RBC during their delivery. Iso nga adati color reddish to pinkish appearance which we call the ruddy complexion. Okay? And there is also decreased amount in subcutaneous fats. So the newborns mayanak adoti RBC or hematocrit or red blood cells, but they have also very low levels of subcutaneous fats or konti lang yung kanilang mga taba, which makes the blood vessels more visible sa kanilang skin. Okay? Kasi wala pa silang mga fat layers, kaya nakikita natin na madalas ay yung mga muscles na color red, and then nakikita din natin very prominently yung mga blood vessels which are more visible. Now, we have abnormal skin colors. Okay? Yung una po is what we call cyanosis. The lips, the hands, and feet are likely cyanotic or bluish in color due to immature peripheral circulation. Duwa nga min apot ti klase ti circulation tayo. When we talk about the newborn, hanga DJ kung fetal can neonatal circulation and you forget about that. I know, don't forget about that kasi nagrigat tayo ngayon nadadal DJ. But it's different. Pag sinabi nating two types of circulation kasi, yung una is the central circulation. So no central circulation ko nam DJ, the body is prioritizing delivery of blood and oxygen to the central part of the body. Anya ba ti central part of the body? Data head, data yanti abdomen mo ken chest. So data ti central circulation. No ibaga tayo met nga peripheral circulation, the body is already providing oxygen and blood to the peripheries. Inyitip ko na tayo nga periphery kay farther from the center. So inyiti farther from the center tayo is your hands and feet. Okay? Iso nga, adati daddo mga newborns nga may anak whose hands and feet are cyanotic or bluish apay because of the immature peripheral circulation. Ang priority kasi na sinusuplayan muna ng dugo natin na oxygen and blood during delivery are both the head and the chest and the abdomen kasi nandito po yung mga vital organs natin. Kaya pag lumabalabas si newborn, since priority pong circulation ay ang ating central circulation, nagkakaroon po ng bluish discoloration on both hands and feet kasi nga peripheral circulation lang yun. Okay? So sometimes yung cyanosis po, it can be because of the immature peripheral circulation, as I said a while ago, so color blue, the saka ken imada, but most of the time, it is because of mucus obstruction. Okay? Meron tayong mga secretions coming from the mouth and the nose, so hanga makaangis insigida the newborn. And when the newborn has problems establishing respiration, they will have cyanosis. So mucus obstruction ang isang problema natin. Kaya nagkaka-cyanosis yung isang bata. And we cannot also discount the fact that the newborn might have heart problems. That's the reason why they are having cyanosis on the skin. Okay? So pag bluish discoloration, you can suspect for immature peripheral circulation, which is normal. Acrocyanosis po yun. Both hands and feet lang ang color blue. Pero pag yung bata ay bluish all over, refer it immediately to the doctor kasi baka merong heart problem na po si newborn. Okay, so like I said, this is acrocyanosis, the bluish discoloration of the extremities, which is usually caused by immature peripheral circulation. Okay, pag color yellow naman po yung bata, we suspect hyperbilirubinemia. And what is hyperbilirubinemia? It is the increase in bilirubin levels in the blood. Okay, saan po nanggagaling yung ating bilirubin? It comes from the RBC death. No matay gamin apo ti mesa nga RBC, ag breakdown isuna. Okay? Maagnas kung natay manlaingin para mas madali yung maintindihan. Okay? So it will break down and then the end product of that breaking down is what we call bilirubin. Okay? So ano aduti matay nga RBC kasi kita nyo na there is increased RBC level in the blood. So ano matay dagito nga RBC, what will happen? The bilirubin will be lodged in the blood of the newborn. So agkaroon to sunanti yellowish discoloration. Okay? Now, the hyperbilirubinemia or the increase in bilirubin levels in the blood may lead to jaundice. Mabaling ag-color yellowish ni newborn, the giyanti skin na. Or hanlang skin, mabaling nga pa di sclera na or giyanti porauti mata. Okay. Now, we have two types of jaundice. Okay, the gemesa abnormal, the gemesa normal. So, we talk about the physiologic jaundice first. When we say physiologic jaundice, amo yung ilatadeta tatayin niya, ay amo yung ilatadeta, no? Physiologic ko na tayo, that means normal jaundice. Okay? So yung physiologic jaundice nyo po, it occurs on the 2nd to the 3rd day of life as a result of breakdown of RBC or what we call hemolysis. Agpabarumet gaminti dara de ubing. Okay? Kasi nga yung mga ginagamit niya noon na fetal RBC or the RBC that has been used during the intrauterine life, mamamatay din po yung mga yon. Okay? And then yung namamatay na RBC, they will be broken down into different substances or components, and yung end product po nun is bilirubin. Okay? So anong mangyayari? Dahil po sa breakdown of RBC, kaya di ba aduti RBC ni newborn, makikita natin yung second to the third day of life, yung physiologic jaundice. So like I said, normal lang po ito, nagkakaroon siya ng yellowish discoloration kasi nagbe-breakdown yung RBC natin, yung fetal RBC, kaya dumadami yung bilirubin levels. Okay? Now, the indirect bilirubin, like I said, is what we call the end product of erythrolysis or the RBC death. So numatay ti amesa nga RBC, ag breakdown suna, and then the resulting product na DJ will be the indirect bilirubin. Okay. So kasano ti mapaspasamak dito eh. So we look at the RBC first. Dito tayo niya RBC dito po. So yung RBC, pag namatay yan, there will be, it will be broken down to heme and globin. Okay, makita niyo po? DJ heme and globin, the result numatay DJ RBC, agudwa data. Now, the globin will be reused by the body, which will be reabsorbed. So anong maiiwan? Si heme. Si heme po, it will be broken down to iron and prothrombin. The iron is also reused by the body. So sinong maiiwan? Si prothrombin. Si prothrombin ngayon ang magiging indirect bilirubin. And si indirect bilirubin po, he is fat soluble. Natutunaw lang po ang ating indirect bilirubin pag mayroong taba sa katawan. Okay? So balikan natin yung slides natin kanina. Yung slides natin kanina, ang sabi dito, meron silang ruddy complexion. Si newborn may ruddy complexion because of the increased RBC and then decrease in subcutaneous fats. So kaya nasabi dito, ni newborn, aduti dara ng fetal RBC, basit ti tabana. Okay, na-gets? Nangato ti RBC level, basit ti fat level. Okay, so punta tayo sa next slide natin. So, nagkakaroon tayo ng physiologic jaundice kasi yung mga maraming dugo, anong nangyayari doon? Is, namamatay sila, therefore, sa second to the third day of life, ang nangyayari, yung RBC, nagiging heme and globin, marius ni globin, and then nagbalintuman nga heme and iron, and marius ni iron, and then it will become prothrombin. Naibagak tatay that your indirect bilirubin is fat soluble. Anya nga rod tatatimang breakdown ka dito indirect bilirubin no nababamit ti fat level ni newborn. Na-gets? So ang nangyayari po, maraming RBC si newborn, meaning maraming indirect bilirubin yung maproproduce when there is erythrolysis. Ngayon, ang indirect bilirubin natutunaw lang sa taba because indirect bilirubin is fat soluble. What will happen next? Anong mangyayari? Dahil sa maraming RBC ang namamatay, tumataas si indirect bilirubin, wala naman pong taba na nagme-metabolize sa indirect bilirubin. So, niya mapaspasamak. Maururnong lang DJ indirect bilirubin in the body. Kaya nagkakaroon ng hyperbilirubinemia yung bata. Kasi walang nagko-control or walang nagme-metabolize ng indirect bilirubin. Okay? So again nangato ti RBC level di ubing. Okay? Nababati fat fat levels na subcutaneous fats. Ni RBC na nakangato no matay dagitoy, they will produce indirect bilirubin. Ni indirect bilirubin, fat soluble lang data, natutunaw lang siya sa taba. Tatan adati tabanan ni newborn, basit. So kaya nasawin, awan ti mang metabolize dagita, ngumangato ti indirect bilirubin mo, niya ti mapasamak. There will be hyperbilirubinemia. Okay. Now, no nagkaroon ti hyperbilirubinemia di ubingin, that will now cause jaundice. Yeah, because indirect bilirubin is fat soluble and the infants cannot excrete this because they also have immature liver which cannot produce glucuronil transferase. Anya nga min met nga enzyme or compound glucuronil transferase. Glucuronil transferase, it is an enzyme that is produced by the liver, which can convert the fat-soluble indirect bilirubin to the water-soluble direct bilirubin. Okay? So kanya tayo nga adults, we have mature livers gamin, so nga dati glucuronil transferase tayon. Ti ubrain na dito yung glucuronil transferase, no ado ko mati indirect bilirubin mo tibagi, okay? And then awan unay ti fats mo pa niya, the glucuronil transferase can convert the indirect bilirubin, which is fat soluble, i-convert na deta aramidin na nga water soluble. Ado ti danum tabagim, when? Ado ti bagim. Isu nga may takkim or may isbum deta bilirubin. Kasi water soluble na siya. Kasi kinonvert ng glucuronil transferase yung indirect bilirubin from being indirect bilirubin to water soluble direct bilirubin. Okay, nagsimple may nga tanyang yung napimpindas ko man nagsasango tayo ta, I can easily explain it to you. But I know that you already understood the topic. Okay. We also have what we call pathologic jaundice. Pag sinabi po nating pathologic jaundice, it is abnormal. Okay? Hindi po yan normal. It is the yellowish discoloration of the newborn's skin which appears on the first 24 hours of life. No makita tayo na yanak ko ba pala di ubing, awan pa iti 24 hours na, nakikita na natin yung yellowish discoloration. We immediately report it to the doctor because that is pathologic jaundice, abnormality data apo. Apay. Because this may be caused by anomalies in the liver or the gallbladder. Okay? So mabalin nga merong tama sa liver niya or sa gallbladder, kaya siya nagkakaroon ng yellowish discoloration. Tunukuan, dumakkel to ti tiyan na detan. Okay? Dagi siya may papabuya, idi nga bantay bata 163 nga nagpapatulong nga dati hepatobiliary atresia na kadakwa. So dagi jay apo di jay. No makita tayo nga within the first 24 hours ang color yellow di jay ubing, we call that pathologic jaundice, abnormal di jay yan. Ngayon no di jay the yellowish discoloration na happens on the second to the third day of life, we call that the physiologic jaundice. It's normal dahil lang po yun sa pagkamatay ng mga RBC. Now, anong pinaka-importante dapat natin na tinitignan dito is that we prevent the occurrence of kernicterus. Okay, we prevent kernicterus. Ano ba kasi yung kernicterus? It is a very dangerous condition wherein the indirect bilirubin will enter the brain. Okay, di ba ti konaktatay no adati nangato ti indirect bilirubin mo ag color yellow skin, ag color yellow sclera, ag jaundice ti ubing. But if there is very high amounts of indirect bilirubin, maaaring yung indirect bilirubin na ito pumasok mismo sa utak, which will interfere its chemical synthesis and functioning. And what will happen is that it will cause permanent brain damage to the child. So mabalin to nga mentally retarded suna or mabalin agkaroon to sunanti problems when it comes to the brain functioning. Okay? So ano ba yung normal na bilirubin level natin? It's 7 milligrams per 100 ml. That's the normal levels of bilirubin. Pero pag mas mataas dyan, we already watch out for, data WOF dita, watch out for, data. We watch out for kernicterus, yung indirect bilirubin maaaring pumasok sa utak, which will interfere with the chemical functioning of the brain. Okay? So like I said, the kernicterus will leave possible mental retardation and permanent effect on the newborn. So pigilan po natin yan. So we have to manage jaundice, either physiologic or pathologic, kailangan i-manage yan ng mabuti. And how do we manage it? We treat jaundice accordingly. Actually, madali lang siyang i-treat eh. Number one that you can do, independently, or I know I want the doctor's order, we can treat jaundice. Okay? The first thing that we can do is we establish breastfeeding. Pasusuhin po natin agad-agad yung bata. We want to speed up the defecation process so as to excrete the bilirubin and to promote reabsorption of the bilirubin. Ano na dardaras nga mairuwar DJ ubing, DJ yellowish discoloration na. Nalagip yun DJ imbaga last time nga no ipainit yun DJ ubing color, no ipainit yun DJ ubing ag phototherapy DJ ubing, agkaroon ti greenish discoloration pa di yan ti takkina. So no, when there is the greenish discoloration in the stool, mabalin nga nandun na din nakahalo yung mga indirect bilirubin natin. So we have to speed up the defecation process by initiating early breastfeeding and allowing the newborn to eat as much as possible. Takki nga takki, isbo nga isbo, para mas madali niyang ma-excrete yung kanyang bilirubin levels. Next, we also have to subject the newborn to phototherapy. Or kung medyo social yung hospital nyo, ayaw nyong pinapaarawan lang yung bata, pwedeng Billy Light therapy. Okay? So dito kasi sa phototherapy or Billy Light therapy, it helps in the maturation of the liver enzymes. The more kasi na ine-expose natin si newborn sa Billy Light or phototherapy, the more po na binibilisan ng liver nila na mag-mature. At pag nag-mature yung liver, anong mangyayari? The liver will be able to produce glucuronil transferase. So yung glucuronil transferase, yung indirect bilirubin, i-convert na niya into direct bilirubin, yung mga waste products ng RBC death. So dito indirect bilirubin, di ba narigat nga i-process di bagitay di kasi awan tita batayo, no na-convert di water soluble direct bilirubin, mabalinton nga nadardaras nga may isbo or may takki dito yung excess bilirubin. Next, during phototherapy or Billy Light therapy, you have to remember the following. Han nga insigida nga mapanyo isa ang di newborn nen, di Billy Lighten or ipainitin. You have to check the doctor's order. Is it necessary? Is it the right patient? Is it the right time that you expose the newborn to Billy Light? Okay, so makita yung dapat yung doctor's order before subjecting the newborn to Billy Light therapy. Next, you also use the Batman's suit. Yung Batman's suit po, ginagawa natin yun to cover both eyes and genitalia of the newborn with a gauze to prevent organ damage. Kasi nga yung Billy Light, medyo strong yan, and since immature pa lang yung katawan ng bata, pwedeng magkaroon ng damage sa mata or sa genitals niya. So we have to cover it using gauze to prevent organ damage. And then, when the newborn is placed in phototherapy or Billy Light therapy, you have to turn the patient from side to side every 2 hours. Bakit po? Para mas maraming surface area ang ma-expose para mas madaling mag-mature yung liver enzymes. So, hang ususto di bagbagada nga ibalibalikid mo, tano pantay pan nakaluto na di ubing, hindi po yun. Binibili light therapy natin na tina-turn siya from side to side every 2 hours para mas maraming surface area ang tamaan ng Billy Light para mas mabilis ang maturation of the liver enzymes. Next, we also have to feed the baby before and after Billy Light therapy to prevent dehydration. Okay? So, mainit po ang Billy Light at pag hindi natin binigyan ng feeding either breast milk or bottle milk si baby before the Billy Light therapy, maaaring ma-dehydrate siya. So, kailan tayo mag-feed? Pag mag-Billy Light therapy? Before and after to prevent dehydration. Okay. Pero pag ginawa na natin yung number 1 and number 2, but the jaundice is still prevalent or meron nandyan pa rin yung jaundice, we can do exchange transfusion. So ginagawa po yung exchange transfusion in cases na sobrang lala na po ng jaundice. Okay? Sobrang lala na, kaya kailangan na nating mag-exchange transfusion. Okay. So paano ginagawa yung exchange transfusion? It is done in severe cases of jaundice and the umbilical blood vessels are used. And ang ginagawa nila, since yung umbilical cord ay naka-open pa niya, hindi pa yan nag-dry up, all blood is drained out of the baby. So tinatanggal natin lahat ng dugo ng bata. And then simultaneously, we are transfusing new blood. Okay? Kasi kung matidating na, ikikatin tayo aming nga dara na nga aduti indirect bilirubin, sa tayo suksuktan ti baro nga dara nga awanti bilirubin na para matanggal po yung jaundice. I'll show you the picture. Apa yung picture dito yan? Wait lang po ha. I have pictures of that if I'm not mistaken. Excuse me lang po. Ay, wala. Sorry, nawala. Bakit nawala? Okay. So since we have... Nawala ko talaga. Sorry. I'll just show you guys next time. Okay, yung ating treatment for jaundice, yung exchange transfusion. Okay, so sorry. Okay, so but we get the idea, di ba? Tinatanggal natin yung, ginagamit natin yung both umbilical vein and umbilical artery, and then yun po yung dinidrain out natin yung dugo while simultaneously binibigyan natin siya ng bagong dugo. Now we also have the pallor. Pag sinabi po nating pallor, yung pallor po is that meron siyang paleness. It is usually the result of anemia. Okay? Bakit nagkakaroon ng paleness yung newborn? It is because of blood loss when the cord was cut. So maaaring maraming dugo yung natanggal sa newborn kasi hindi maganda yung pagka-apply mo sa umbilical clamp. Kaya nung kinat mo, maraming dugong nawala. So that can cause pallor on the newborn or paleness. Maaari din pong it is caused by inadequate blood flow from the cord into the infant at birth. So ibig sabihin niyan, maaaring hindi po maganda yung pag-flow ng dugo from the placenta to the fetus intrauterинely. Kaya ang nangyari is nagkaroon ng inadequate blood flow. Okay? Kaya paglabas ng bata, may anemia or pallor. Or pwede rin may maternal fetal transfusion. Ibig sabihin nito, there is a problem when it comes to the chemical components of the blood. So maaaring katulad niyan ng ABO incompatibility or RH incompatibility wherein the blood of the mother is destroying the blood of the newborn. So kaput ag kinontra de judara ni nanang ken de ubing, it causes pallor paglabas ng bata. Or maaaring din pong hindi kumain ng masusustansyang pagkain yung mother during pregnancy. Kaya nangyari, nagkaroon ng low iron stores in the body because of poor maternal nutrition. So anong nangyari? Nagsuffer yung bata yung nagkaroon ng paleness. So newborn, makikita nyo misis, apay hanggang nga nanganti, adong green leafy vegetables, hindi masikugkan, damagan yo, when sir, hanggang nga kayat. So makita yung ubing, ang color niya, instead na ruddy red, is pale. Okay? Or pwede ding, like I said a while ago, maaring blood incompatibility din. It can be caused by the RH incompatibility or the type ABO incompatibility of the blood. So the large numbers of RBCs of the newborns are destroyed inside the utero because the blood of the mother is destroying the blood of the newborn. Or maaari ding nagkakaroon sila ng paleness because of internal bleeding. So, paano natin malalaman kung may internal bleeding? We watch out for bruising. Baka may mga pagpasa-pasa. Si newborn, may pasaba siya dito sa likod, sa tiyan. Baka internal bleeding po yun. Kaya siya merong paleness. Or, is there blood in the stool? Baka merong bleeding po sa gastrointestinal system. Or, there is blood in the vomitus. Meaning, baka meron pong bleeding on the upper GI tract. So, marami pong causes ng paleness. And isang tinitignan natin is internal bleeding. Or, pwede ding it's caused by central nervous system damage. Baka merong damage sa brain or spinal cord. So, yung bata, it can either appear pale or cyanotic. So, mabaling pangagiddan. Pale can cyanotic pa pag meron siyang central nervous system damage. So, if you see pallor in the newborn, you have to determine the cause. Okay? And you will only be able to determine the cause if you tell it to the physician or to the pediatrician immediately pag nakita po nyo po yung paleness. Because paleness is not a normal finding in a neonate. Kasi ang color po dapat nila is ruddy red. Okay? Next, pag nakakakita po tayo ng gray skin, it indicates sepsis or infection. Pag yung bata nagko-color gray, automatic isipin nyo na may sepsis yan or infection. Meron din po tayong tinatawag na Harlequin's sign. When we say harlequin's sign, amamuyo ni harlequin. Di harlequin kay isuna DJ asawa ni Joker. Half blue, half pink. Okay? Kaya siya tinawag na harlequin's sign. It is due to the immature circulation of the newborn. The neonate who lies on his back no nakasikig ko mga nakaida di ubing niya, the child will have a red skin on the lower dependent side while the pale skin, there is paleness on the upper side. Okay? Nakakatakot ba yung harlequin sign? Hindi po. It's somehow normal. It has no clinical significance eh. Hindi po siya ganon ka-clinically significant. Hindi siya nakakatakot. Okay? Kaya normal lang. It goes back if the child is repossessioned, or it goes away, I should say, if the child is repossessioned or when the baby cries or kicks vigorously. So pag yung bata po, nakasikig, agudwa di bagi na kano nga ti kolor. Di mesa nakalablabaga, di mesa nakapepale. Harlequin sign ang tawag natin doon. Although it is of no clinical significance, nawawala din yan kasi if nire-reposition natin yung bata. I think I have a picture. Malasin me lang. That is a clear-cut indication of a harlequin's sign. So as you can see, the newborn is red on the lower aspect, and then on the upper aspect is pale in color. Okay? I think that ends our discussion for this evening. Paki-check po yung ating handouts kung yan na ba yung end, yan na ba yung nagsisignal ako ng quiz or hindi.